예, 스트리밍 되네요.
And you can still see me?
Yes, we can.
Perfect.
Alrighty. Now we're live. Hello, everyone. Thank you so much for joining us. We're WebCeph S, and we're super excited that you're here. And we're excited to present you guys with many virtual shadowing opportunities. So before I begin, I would like to introduce the director of WebCeph S, Dr.Jae-bong Park.
Okay, can you hear me?
Yes, we can.
Yeah. Hello, members. I'm Jae-bong Park, the director and creator of WebCeph X channel, and also an oral and maxillofacial surgeon in South Korea. Up to today, WebCeph X have been inviting professional speakers in the field of orthodontics, oral surgery, and implantology from all around the world to deliver webinar for 30,000 members. However, there were many opinions on creating a separate channel for pre-dental and dental students. So, with Sun-woo Kim and Subin Yoon, the intern of WebCeph and moderator of WebCeph S, we have launched the WebCeph S channel after several months of planning. We are planning to offer a webinar about dental school entrance, life in dental school, and also a dentist from speakers who are dentists and students too. Now we will be sharing detailed information through the WebCeph S tab in webceph.com, and your support is great help to us. We hope you can take advantage of this channel. Thank you. Thank you very much.
Thank you, Dr. Park. Now, today we have Dr. Khan to talk to us about her journey as a general dentist. So thank you so much for joining us, Dr. Khan. And whenever you're ready, the floor is yours.
Thank you. Well, first of all, thank you all for having me. My name is Dr. Khan. I have been practicing for about 4 to 5 years here in the United States. I am a general dentist, and so I graduated from the University of Toronto in about 2017, and then I shortly moved to the US. So my entire work experience has actually been here in the United States. Although I'm a general dentist, in the first 2 years of my career, I decided to get more advanced training in areas like implants, Invisalign, and orthodontics, as well as, I would say in front of Dr. Park, minor surgery. I decided to pursue some of those areas. So I do offer a lot of those procedures in my practice. So at any time, if you have any questions, please don't hesitate to interrupt me. But unless I hear from you, I'll kind of keep going. So before my dental degree, I actually did a master's in business. And I think what that really helped with was my business acumen and helping me decide that I eventually definitely wanted to be a practice owner. Then I worked corporate marketing for 2 years prior to dental school. So I worked for really big brands here in the United States. And that basically taught me how to do marketing and brand management for a lot of, big brands that you probably know, like Neutrogena, things like that. I got into dental school, I realized I really wanted to serve patients. Patients were my true calling. So I decided to go to dental school. And like I said, I pursued continuing education in some of the areas that we discussed earlier. Currently, and this is kind of old, but currently I'm with another employer, but I am starting my own practice. I can say that now. So I am sharing that journey on my Instagram page of what it's like to buy a practice here in the United States. All the steps that are involved in that. I mean, it is a very strenuous process. Lots of legal things and accounting and marketing and all of that. So currently I'm really busy in getting that practice up and running along with the marketing. But prior to owning my own practice, I did work corporate dentistry. And for those of you guys that don't know, corporate dentistry in the United States is basically a business firm that owns several dental clinics. So this particular corporate employer owned about 3,000 dental clinics in the United States. And they hire the dentists, give them benefits and a compensation package. And then you basically, they handle all of the other things for you, like marketing and materials and staff and hiring, and then you basically come in and for the most part you focus on the dentistry. So in my journey, one thing that I really talk about here, especially something that affects us in the United States, is that the average cost of dental school here is about $300,000. And so, I just want to bring light to that because there's a lot of challenges to that as well. So on my page, I talk about paying back that. Because of the business background, I was able to pay my loan off a lot faster than the average person, through investments and real estate and things like that. So I do try to provide that perspective because I think as science students, we don't get that business training. And it's really important because not only do we need it to pay back the debt, we also need it eventually to start our own practice. And so, I think having that business training is important. And there's no business course in dental school. So here are some of my pieces of advice for pursuing dentistry here in the United States. Obviously, your GPA is going to be a huge focus, but focus on the science courses. Focus on your prerequisites. Don't just take, a major that you won't do well in. For the DATs or the dental admission test, write them early. Write them as early as you can so that you can rewrite them for higher scores. For interviews, personalities are very, very important. So find a dentist in the US or a professional or someone in dentistry to help take an interview. Do mock interviews with them to see, put yourself in different situations so that you do well. And then for attending school, I always say, people always want to go to schools like New York and California, and they're great schools, but they're very expensive cost of living. So try to find a school where the cost of living will be low, therefore you graduate with less debt and less to pay off after you, are done. Any questions on that so far?
I think we're good so far.
Okay. So, I like to keep everything very interactive, and then I focus on the question and answer all the way in the end. But, as a general dentist, what I love about my job is that there's such a variety of things that we can do. There's such a variety of things we can further specialize in. We'll never be able to, deal with severe cases. We'll never be able to do completely advanced surgery or completely advanced orthodontics or completely advanced endodontics, which are root canals. But we can do most of the cases in those realms, excluding oral surgery. So, in my practice, it is a predominantly cosmetic practice. So when we play these games, just remember that there is a cosmetic focus. So the first patient is right here. She is about a 65-year-old patient. She came to us, and as you can see on the left, she had quite a bit of crowding, anterior crowding, a misaligned bite. If you see that lateral on the upper left, very, very rotated. So I wanted to, open this up and, ask all of you if you have any answers as to what we did to transform the smile. You can talk about procedures or you can talk about specifics. Any takers?
Did you widen the, the chin inside of the mouth? Because I see that her bottom tooth is crooked, and I think maybe it's because it's the chin is too short. There isn't enough space. Maybe
That would be a very interesting procedure if I could perform it, but unfortunately, I just could not do such advanced surgery. So what we did here, but good guess. I think what I like about your answer is you notice the expansion of the arch, right? So here, what we did, first of all, any other guesses? No. So what we did here is we basically expanded the arches through orthodontics. So we put the patient through Invisalign. And the only difference between the left side and the right side are about 9 months of Invisalign. And the patient did not end up in this open bite that you see on the right side. The bite was fully closed. I just took this to show how much we were able to straighten the top and the bottom. But this is an example of, patient came in, was unhappy with the way that their smile looked, and we were able to just straighten it out. Like, this is no veneers, no crowns, no whitening. This is just straightening the teeth out that made such a big difference. So, a lot of the times people think general dentistry is very, it's very harsh. You remove tooth structure, but sometimes you can, actually most of the times you can treat these cases very conservatively, and very, very easily as well. So this is our second patient. She came in, and as you can see on the left side, she has quite a bit of crowding. She has a very narrow arch on both the top and the bottom. So I'm going to open this up again. What do you think we did to transform the smile?
Would it be a simple braces treatment?
That's a very good guess. She is about, I want to say she's about 75. So she's 75 years old. And typically my oldest patient in Invisalign has been about 70, I think the benefits of straightening teeth are very evident. There's a lot of research to say that's much better, even cosmetically, to do. But here, she did not want to wait to have a prettier smile or a more beautiful smile. So in her case, we actually did 6 crowns in the front on the top. And the reason why we only focused on the top is because look at her smile line on the right. When she smiles, you do not see bottom teeth. So essentially, 6 veneers or 6 crowns just straightened out the smile. And, she was very happy with that result. So she got a straighter smile and then obviously a wider, brighter smile. So this was more of a cosmetic case that we worked up, and we decided on basically transforming them out with that many crowns. Any questions on that? All right, I'm going to move on then. So another guessing game. So as you can see on the top, this patient came in. He's about, he's almost 80 as well. He came in, he had lots of crowns and bridges and a very deep bite. He also had, in some of the marks that you see, if you look at the top picture, you see the red marks and the blue marks. Those are basically paper that we use to test the bite and how deep it is and how he bites. And you can see that he's biting very heavy on his bottom teeth with all the blue that you see. So, he came in, he had a 50th anniversary and he really just wanted to change his smile. So we obviously ended up going the veneers and crowns route. So take a guess as to the number of veneers or crowns we did here.
I'm going to take a wild guess and say 10.
That is perfect.
Actually,
that is 100% accurate. And the way that you can tell is you can just count, right? So if you divide the smile line in the middle and you count the changes, like 5 on the left and at least 5 on the right look like they've been changed. And with him, he really just wanted a bright Hollywood white smile. That's what he came in with. He wanted the lightest color. He wanted the most perfect shape. So he was looking for more ideal. A lot of my smile makeovers, they're like, if you look at the picture here, it's a little bit more natural. It's not bright white. It's a little more forgiving. But here he was like, nope, give me the whitest. I mean, I have this much time and I want to have the whitest smile. So we actually first we fixed up all the broken teeth, all the decay with crowns and root canals if needed. And then we went and we did a cosmetic workup. We did about 10 veneers and crowns for him. The teeth that were badly broken, like this one, for example, got a crown. This one got a crown. But the rest of the teeth we were just able to veneer. Actually, this one was an existing crown, so we replaced that. But the rest of the teeth in the back we were able to veneer. The front 4 teeth had crowns, and the reason is crowns. They would have been more stable for his bite. So that's how we decided between veneers and crowns. So that's the third case. So this is a lot of my kind of the type of treatments that I do. It's a lot of orthodontics, a lot of cosmetics, and then replacing missing teeth with implants and sometimes dentures as well. Okay. Any questions on this case? All right. So that is honestly kind of what general dentists do. In the United States, general dentistry has a lot of variability. So this is my practice. My practice is predominantly cosmetic. A lot of dentists, they focus on, for example, only emergency procedures. So they'll focus on root canals and extractions and dentures. Then there's some dentists that focus on very basic dental procedures like fillings and crowns. So the good thing is you can really transform your practice based on your skill set. And if you want to do more, you can do shorter residencies or fellowships and advance your skills enough to be able to provide more advanced procedures like sedation, like oral surgery. Obviously, you cannot reconstruct the jaw, but you can do a lot of advanced surgery within the mouth if you get that training. So now I'm going to open it up to any questions and answers that you might have. And yeah.
Thank you so much for the informative session, Dr. Khan. So you briefly mentioned Invisalign. So we were wondering, what's your opinion on like the third-party invisible aligners such as Candid and Smile Direct Club?
Absolutely. So I always tell my patients, because obviously who doesn't want something cheaper, right? So there's 3 main differences between Invisalign and Smile Direct Club. The material is thinner and not patented. Invisalign's material is thicker and patented. So it's a smart force technology that actually works a lot faster. Your treatment time with Smile Direct is going to be longer because it's not patented. It's not the same material. And for those of you guys that don't know, Invisalign used to own Smile Direct Club, but they actually parted ways about a year ago. So the treatment time is going to be much faster with Invisalign because A, the material is different, and B, it also gives you attachments that are applied by a professional, and the attachments basically increase the retention of the trays to the teeth, and so the teeth will move a lot faster. With Smile Direct, there are no attachments, and the third main difference is obviously one is an at-home treatment that is not necessarily monitored by a dentist, and secondly, Invisalign is basically a doctor-based treatment, so you would go into a doctor's office and then you'd be able to get the treatment. So it's better tracked, especially for cases that have extreme bites or deep bites, open bites, like more complicated bites, or they have gum conditions or gum disease that needs to be managed in addition to the disease. It's a more doctor-led treatment.
I have a question. So why did you choose general dentistry instead of specializing? What are the benefits of general dentistry?
That's a really good question. So for me, in dental school, the only specialty I was interested in was oral surgery. I never really developed an interest in the other specialties. I could never see myself doing those things every single day. Oral surgery, I could. But as you know, oral surgery is a very long route. So here in the United States, you either have a 4-year program, which there's much fewer of them, or a 6-year program where you have to go to medical school for 2 years, and then you do an oral surgery residency, and then even possibly a fellowship after that. So it would be another 6 to 7 years of additional school and training. And at that time, I was just, for me, from a life perspective, it was too long. So the reason why I picked general dentistry is because as a general dentist, you can take certifications and courses. You cannot provide, reconstructive surgery, but you can do basic surgery within the mouth, like implants or sinus lifts or all of that. So then when I graduated, I focused on a lot of those certifications to be able to offer some of those procedures.
That's amazing, doctor. We have a question in the chat. So if you go to a dental school in an Asian country or maybe like other countries as well, can you still practice in the States?
That's a good question. So from what I know, you need to give the TOEFL test and the INDBE. So that's one route of being able to do that, which means you need to clear your English test and you need to clear the international dental boards in order to be able to practice. That's one route. The second route is pursuing a master's or residency in dentistry here. So applying for like a periodontics residency or, an endodontics residency, whatever it is that you're interested in, you can do that. So you cannot work here without those two paths.
And there's another question. How did you balance like work and a lot of schoolwork? I know that dental school is really busy and we have a lot to study. So how would you like balance all the stress and work and homework and all those tests with your personal life?
I don't know if you're gonna so I knew I didn't want to specialize, right? And I think the stakes are different if you want to specialize. If you want to specialize, your GPA has to be within the top 10% of your class. So you have to work harder, honestly. And you have to be the top of your class, at least the top 10% of your class. So I discovered pretty much in my first year of dentistry, I was not going to specialize. And at that point, I don't want to say my GPA did not matter, but I was okay being an average student. Some people were very obsessed, even though they wanted to be a general dentist, to be the top of the class or do specific residencies. And if that's your passion, then it's going to be stressful to manage. But I was okay being an average student and learning at my own pace. So instead of, getting A's in dentistry, I had B's. Right. And then when I graduated, I did a ton of continuing education in the areas where either I was weak, right, or in areas I wanted to pursue. So over the longer term, I feel like when compared to a lot of my colleagues who are A students, I feel like I learned a lot even after graduating because I still knew I wanted to learn. And I think if you think about dentistry as an ongoing learning, you're going to be way less stressed in dental school. But if you think about it as, I have to learn everything in these 4 years, you're going to stress yourself out. So it's priorities. And then, I think it's just being able to carve that time out for your social life and all of that. And I did that.
Thank you.
So another question is, how did you connect with your corporate job?
Connect as in how did I get the job or how did I feel that experience was?
I think they meant like, how did you find the corporate job?
Absolutely. So I actually talk about how to find your first job on my Instagram page. There is an IGTV for those that are in dental school, where I talk about how I used Google search and all the employer search engines to locate my top jobs and how I applied for it. And then what were some of the factors that I use to decide, but that's about like a 7 or 8 minute lengthy discussion on that you can check out. If I had to summarize that, I basically signed myself up for Google job alerts with the employers that I wanted to work for. So I found few employers that I enjoyed or that I knew had good reputations. And I basically just signed myself up for alerts. And then when those jobs came up, I was instantly notified and I applied. So that's how I did it.
So we have another question in the chat, and Amber asks, what aspects did you focus on when you were choosing a dental school? I know that you talked about the living cost, but were there any other aspects that you considered?
I'll be honest, I would probably go to dental school wherever you see yourself practicing. I think you'll be able to meet a lot of dentists nearby. You'll be able to make, connections. You'll be able to know your faculty in that city. I think that's the easiest to do. Obviously, in the United States, having 500 dental schools, you're not always going to get into the one that you're closest to. But if I had to prioritize as somebody going through dental school, that's what I would do, and that's what I did. Even though the dental school that I wanted to get into was extremely competitive, it was in the city I lived in, so it would keep my living costs low. And then I had family nearby and all of those things. And I didn't get in the first year I applied. So I actually ended up deferring some of my other acceptances to try another year. And I did get in the second year that I applied.
I just have like a follow-up question to that. So if you go to school that like you're not gonna practice like in the city, so if you go into a dental school that you don't want to practice in, would that be like a huge disadvantage, or would it not?
No, I think the other gives you an advantage, but necessarily the other doesn't give you a disadvantage, right? I don't think so. I think nowadays we have so many ways to connect with people in different cities, right? We have LinkedIn, we have Instagram, we have, all these other social platforms where you can connect with doctors and dentists and employers in the cities you're interested in. I think it's just easiest if you go somewhere that you want to be in because it gives you that maybe a little bit of an edge, but I don't think it's a disadvantage, really.
Okay. Thank you.
Right. So the next question on the chat says, how was studying and taking the DAT? How many times did you take it? And how difficult would you say it was?
I think I took it twice because I did the Canadian DATs and then I did the American DATs. And the Canadian runs had different requirements and the American boards had different requirements. So all in all, I think I wrote each of those exams twice. So I wrote exams like 4 times. But in terms of difficulty, I think if you have a decent GPA, like anything above 3.5, it won't be difficult. It's just about practice. So what it's more about is test taking. Okay, you have to master the test. If you think and you go into the DATs, you're going to know 100% of science, it's the wrong approach. You have to think about, I am not here to master science. I am here to master the test taking. And if I can master the test taking, I will score well. Because the first time I wrote it, I was so nervous. I'm like, I don't know everything about biology. I don't know everything about, chemistry. And how can you? You don't know what question you're going to get. The second time I did it completely different. I was like, based on the first time, what were the high yield topics that came on the exam? And I'm going to master those topics. Did those topics matter in dental school? Most of them didn't. But I mastered test taking instead. So if you change your mentality, because as dentists, we're all type A, we want to know everything. If you change your mentality to test taking instead of, mastering science, it'll be much easier.
So I do have a follow-up question with that. If you want to apply to a Canadian dental school, do you have to take the Canadian DAT?
I believe, yes, you do have to take the Canadian DATs. And for the American schools, you have to take the American DATs. I think America accepts the Canadian DATs, I want to say, but Canada does not accept the American DATs. I know that for sure. And I will say the reason why I wrote the American DATs was because they were much easier. So I would have rather applied with my American scores to American schools than my Canadian scores, because the Canadian scores were harder to get.
We have another question in the chat. Mark asks, how was studying / taking the DAT? You mentioned that like 30 seconds ago, but like how many times did you take it and how difficult would you say? So if you could like make a scale out of 10, how difficult
I would say I'm never the top of my class student. So I think I took each test twice. From what I can remember, this is 10 years ago, you guys. But from what I remember, I took each test twice. And on a scale of 1 to 10, I think the difficulty was a 7 or an 8. I don't think it's going to kill you. I did take the MCAT, and that would kill you. Like, the MCAT is significantly harder, in my opinion, than the DATs.
The next question in the chat says, what stats should we aim for? So in terms of DAT, GPA, shadowing hours, and extracurriculars, etc.
I would aim for a GPA of at least 3.5 plus. If you want to be extremely competitive, 3.7 plus, but at least 3.5. I would aim for a science GPA of at least 3.3 plus. I would aim for a DAT score of 20 plus. 19 is okay, but aim for 20 plus. And shadowing hours, I don't think it matters how many hours you have. I firmly think it's about the quality of your experience rather than the quantity. Somebody that shadowed a dentist for 500 hours, I don't even know if you would learn anything shadowing a dentist for 500 hours, you know? I think whatever you need to learn, you can learn in 20, 30 hours, but it's about what you learned and what you took away and how do you write that in your personal statement and how do you talk about that in your interviews. And then for extracurriculars, I don't think it matters what you do. Same thing, focus on quality over quantity. So pick one thing that distinguishes you from the rest of the candidates. So think about that when you're picking your extracurriculars. And then talk about that one thing.
You have a question in the chat asking about what do you think is the most difficult part of your job?
Managing staff. It's not dental, it's the staff. Dentistry has high turnover in the United States, and it is very difficult to find people, train them, and then they leave. And then you find new people, train them, and then they leave. So I feel like in the beginning, to find a team that's going to stick with you, that was the hardest. Finally, when you get that team and you find the people that you get along with and all of those things, then it becomes easier. But I think finding staff is the hardest, and training them and retaining them. I think it's not the dentistry that's hard. It's the dynamics of the practice.
Just a follow-up question to that. So would you recommend like pre-dental students to minor in business?
I don't think it can hurt you. Yeah, I don't think it can hurt you. I think business gives you a lot of skills. Don't do it if you hate it, because you won't do well. It's going to bring down your GPA. But do it if you're interested. I don't think it's hard stuff. Business is common sense, right? Economy is common sense. So I actually quite enjoyed it. I minored in economics, even with a biology degree. And then I used those courses to get into business school. So, you know, I feel like I have a lot of common sense when it comes to business because I studied the economy and the trends and the market trends and all of that stuff. So it will only help.
So would you say that it's like a big help when we, I guess, like open our own practice?
I would say it is. Yeah. I feel like I feel more prepared for it than a lot of people. And I am not scared because I've studied business, you know. Not to say the type of business you study is going to be a dental practice. It's a very different type of business, but you understand the basics.
Thank you for that. So another question is, how has COVID impacted your life as a dentist?
So they said, according to the ADA and the dental economy, the dental economy in the United States is back to normal pretty much starting August. So starting August, we'll start to have the same number of patients in the dental office as out. Most dental offices last year experienced about a 20% decline in their revenue. And so that's about a fifth loss, right? Which with COVID, I think it's still pretty good, honestly. 20% is not bad for COVID if you look at all the different industries that were hit. And I know dentistry started recovering within 6 months of COVID. So generally, I think we're seeing upward trends. I'm not worried about COVID in dentistry here in the United States.
So we have another question in the chat asking, so did you apply out of province dental schools in Canada, like out of Ontario schools, and are they harder to get into?
It is harder if you apply out of province because they have more limited seats for out of province students. So I did just apply to the Ontario schools.
Another question says, which state would you say dentistry is very in demand?
Which state?
Like US state, I think.
Anything remote. So the smaller the state and the smaller the population, the more in demand you'll be. The bigger the city and the more the population, the more people want to move to a New York, the more people want to move to a California or a Texas. These are all in demand states, the more competition there will be amongst dentists. So as a rule of thumb, if you're looking for your first job, I would say if you want to do really well in your first year, go to a smaller state.
And this is just a general question. So are there any recommendations to pre-dental students on how to work better with our hands, so improving our dexterity?
I actually really like that question because I feel like I was questioning my ability to work with my hands, you know, and if I could do it. But as a kid, I did a lot of hand things, like I did henna artistry, which requires like very delicate work with the hand. But I would say what I did to prepare for the perceptual ability test part of the DATs is I did a lot of hand-eye coordination games online. So I just found all these games that allowed you to see things in 3D and use and visualize and, you know, all of that. And I did think that helped. I don't know how much it helped, but I did think that helped to kind of, because I was having trouble seeing things, you know, like it's hard in the beginning to see things at different angles, different, you know, those punches or whatever it is, like to visualize. So I think those things did help.
Okay, so another question says, in the beginning of starting up your practice, was it difficult competing with other practices?
I am starting my official practice so I bought it, but I am officially starting in August. So I will have to tell you how that goes. And I will share that journey on Instagram on how that goes and how difficult it's been, because everyone tells me it's the hardest thing you'll do as a dentist because now you're responsible for the whole business. So I don't know. I can't comment on how easy or hard it's going to be, but I'm excited.
So I have a question. So in addition to business, do you believe like learning psychology during undergrad is beneficial when you practice dentistry with the patients?
It's one of those things I don't think it helps or hurts. I don't see how studying psychology would be beneficial. I actually remember psychology being very difficult to study because I took first year psych too, but I don't think it can hurt. I think knowing about different personalities and all of that, like, I don't think that could hurt, but having not studied it enough to really comment on that, you know?
So do you have any recommendations on any subjects that would be beneficial for undergrad students other than science?
I think you should pick, truthfully, the easiest major you can do with your science prerequisites. Because ultimately, I don't think I don't think my undergraduate degree was very helpful in real life. Okay. Studying about cellular biology and organic chemistry, I don't even know how that relates to real life. You know, my dentistry degree was very valuable. You know, it gave me hand-eye coordination, it gave me skills, it gave me clinical, it gave me a lot. But I don't think so. I think you should just do what you're interested in. Study music if you want to study, but take your science prerequisites because you'll enjoy your experience. You'll learn something, and I think you'll do better because you enjoy it.
Thank you.
That's a great piece of advice. Thank you for that. Another question is, how do you find balance in running a profitable practice while providing quality care?
I think, and I firmly believe in this, if you treat your patients right, they will refer you and you will become profitable. Okay. If you have no interest in your patients, which some dentists don't, like, they don't really enjoy conversing with them, they don't enjoy talking to them, then it's going to be hard for you to do well. Then you better be really good at your job. But, you know, if you can connect with your patients and build personal relationships and ask them to refer you and they refer you to family and friends, you'll do well. So I just treat my patients like my family members, and they end up referring me to their family members. And then it does well. And remember, profitability is not just about revenue, right? Profitability is about expenses. So what are your expenses like? So where I work on is more the expense side. Like, how can I control my expenses? Because that will dictate how profitable I am.
So that kind of relates to my question on like debt and money stuff. So on average, how long does it take to pay off your debt, and like on average, like also other people?
In the United States, it takes about 7 to 10 years to pay off debt. I worked throughout dental school, so I did not accumulate as much debt. I also had a lot of scholarships in my undergraduate degree, so that helped with paying for a lot of school. So I had much less debt to pay off. But with the $300,000 type of debt, you are looking at about 7 to 10 years to pay that off. I think there's ways to accelerate that. I definitely do. And I think it's all about managing your money once you graduate.
So would you say it's not hard to pay off your debt, like once you become a dentist?
No, it's pretty hard. It's hard, but it's not impossible. And I wouldn't let the debt make you adverse to going to dental school. It is the most expensive degree, but because it has the highest return. In what medical profession can you graduate and start working right away and make almost as much as an experienced dentist? Only in dentistry, right? In medicine, you'd have to do residencies and fellowships and this and that. So it's all about that. And then remember, your debt repayment is not just about how much debt you have. It's about what you do to repay that debt. So that's where I think having a business background does help, because you can start thinking about investments and real estate and this and that to help repay that off.
So the concept of virtual shadowing was not a thing before COVID, obviously. and it's established to help pre-dental students who can't find shadowing opportunities in the midst of a pandemic. So how would you maybe like give a piece of advice to pre-dental students in seeking shadowing opportunities in person?
I would say maybe start on social platforms first. Like start with LinkedIn or Instagram and see who's willing to put themselves out there. Obviously, if they have like a ton of followers and they're an influencer, they're not going to have the time to provide shadowing to every single person, right? But there are other dentists that are not influencers, to say, that are on these platforms that are more than willing to help and mentor. So I would start with those and see if you get traction with that in your area. And then the second thing is, I don't know any dentist that if you walked into their dental practice and was kind to their staff and left your resume and requested a shadowing session, I don't know many dentists that would say no. So it just requires the effort to do that. I think if you do that, and even if a few dentists say no, you'll have somebody say yes.
How is your overall satisfaction with your job right now?
It's a 9 out of 10. Yeah.
Mm-hmm.
I'm really happy I did it. I was supposed to be a medical doctor, and I'm really happy I didn't do that. And, you know, I think everything happened for a reason, and I'm really, really happy that I went the dentistry route. I think I have a lot of work-life balance. I don't have to work nights, weekends if I don't want to. I can be a business owner faster. So I really think for me, this was the right approach.
And how would you illustrate your journey to become a dentist? So like your dental school years as one word or two words.
Persistence. You know, and nothing happened for me right away, and that's okay. You may not get into your dental school of choice. You may not get into dental school at all. You may not do well in your DATs. You may almost flunk out of your first year of dental school. All of those things happened to me. And I'm doing just fine now. So I think failure for me is not something I look down upon anymore. I actually think it's actually quite nice in the long run, not in the short term when you fail, because you realize, okay, this is what makes me resilient. So my biggest piece of advice would be just be persistent, be resilient, and you'll get there. It's not rocket science.
Thank you. So another question in the chat says, what jobs or scholarship opportunities should we look out for in dental school?
In dental school, I don't know about in dental school, but when you get into dental school, there are a lot of like, you know, income-based scholarships that that school may help with, or financing that that school may help with. So I would look at that. I would also think about your debt as an overall. It's not just dental school debt, right? You have your undergraduate degree, and then you have a master's possibly. So what are you doing to alleviate debt early on? Apply for grants, apply for, like, even if it's books, you know, get stuff covered as much as you can. If family members are giving you money, ask for cash, you know, things like that. I think can help with the day-to-day expenses, you know, day-to-day school expenses.
So I have a question on difference between dental schools. Is there a big difference between graduating an Ivy League dental school and a non-Ivy League dental school?
No, I don't think so. I don't think it matters what you graduate out of. I think everything you do with your dental career is gonna really depend on what you do after your degree, because everyone has the same curriculum during dental school, right? It's the ADA's curriculum. It has to be most of that. So yes, you may learn all of it, you may learn a lot of it and more, you may learn some of it, but it's the same curriculum. So what you do with that dental degree is really going to depend on you. I would not go crazy over Ivy League schools. I went to the top school in Canada, and I don't think our dentists are generally better than other dentists. or I don't think that forced me to be a better dentist.
What would you say it's the greatest advantage of going to like a top school then?
I think this is more of an American concept, and I didn't do school in America. I did school in Canada. In Canada, the curriculums are very, very consistent. It doesn't really matter what school you go to. Now, with that being said, there are some schools that may provide like fellowships or residencies or like little mini residencies in summers. And maybe by going to their programs, you would have some kind of advantage with those. So I think like Penn, for example, has stuff like that where some of my colleagues ended up going there and doing this little mini fellowship in their summers. And I guess maybe if you were at Penn, it would be easier to get those opportunities. I don't know. But I don't think there's a big advantage in your brand name of school. I don't think that. Like nobody, when you graduate, nobody asks you where you went to school in any employer interview. I'm not kidding you. It's true. Nobody asks you. Even if you sit there saying, I'm from Harvard, people would almost be like, okay, and, like, what's your point? Does that make you better? I don't think anybody really, I went to Toronto. People still didn't ask me, like, what is that? In the United States, nobody asked me, why did you go to school in Canada? They didn't care. Once I had a dental license, they just looked to see if my license was active.
So it doesn't matter when you get a job in the process of getting a job?
No, I think the only time it matters is if you see yourself doing a residency in that school and you want to get close to the faculty there, then I would pick that school, But do I think it makes a difference in general dentistry? No.
So would you recommend, so if a person is planning on specializing, would you recommend to go to that dental school?
I would.
That residency?
If you wanted to do residency at that school, yeah, then I would try to get into the undergraduate program because it's going to get you closer to the professors who are going to write your letters of recommendations. It's probably going to get you closer to the faculty that lead those programs. So absolutely, then I see value, right? But you have to know why. If you're doing it because, oh, it's just a fancy name, I don't think it's going to get you much. And you may just overpay for your education.
Thank you. That helped a lot.
Absolutely.
So another question is tips for what to ask about during in-person shadowing and what to take note of.
I think you want to find the right person that wants to teach. Because how are you going to know what to ask when you don't really know the profession? You should find a mentor that's interested in showing you the procedure because it's very repetitive work. And if you're just sitting there watching them and they're not explaining anything, you're not going to learn anything. So my recommendation will be to find somebody who does take on mentees and shows them because they're probably really interested in teaching you. In terms of questions to ask, I would ask non-work related questions too, like how's your work-life balance? How's the income in this area if I want to work? Would you recommend being a dentist? What do you think are the challenges? Things like that, I think will give you a practical perspective.
I think I have one more question. So
can we make this the last one?
Yeah, sure. So I've heard a lot about the oversaturation of dentists. And do you think this is true because you're in the field right now? Or are we still at we're lacking dentists?
In major cities and states, we are saturated. So in Texas, California, New York, Chicago, Illinois. In a lot of these major cities and states, we are saturated. And when you're saturated, your overall income, it's a supply and demand thing, right? When there's too much demand, your salaries are going to be lower. So supply and demand are based on also where you are, location. So if you are in a less saturated state, you'll be just fine for the next 20 years. Can't predict anything after 20 years, but for the next 20 years, I think you'll be just fine. So as long as you're open to moving, you should be okay. If you're stuck to any one of these major cities, you better be prepared for high cost of living, a lot of debt, and oversaturation. And as long as you know that's what you're getting yourself into.
Thank you.
So that's all the question we have for today. Once again, thank you so much, Dr. Khan, for joining us. We appreciate you taking the time to speak to us. And also thank you everyone who joined us today on our live stream. So regarding the post-session quiz, it will be accessible through our WebCeph website. We've uploaded a short tutorial video on how to access the quiz on our Instagram and YouTube, so check that out. Anyways, thank you so much for joining, everyone.
Thank you so much for having me. And if you guys need anything at all, you can reach out to me directly. I do have to put my kids to bed, so that's why I had to wrap this up. But thank you.